Sometimes clients will call me asking about a kind of case that is called in the field failure to diagnose cases. What is a failure to diagnose case? That's a case where the physician fails to diagnose a disease or a condition that, under the circumstances, they should have. And as a result of not doing so, whatever that disease entity is progresses and cause the patient harm. Examples of that, of course, would be cancers. Every kind of cancer, unfortunately, has a failure to diagnose kind of case associated with it. Examples would be prostate cancer, breast cancer, colon cancer, lung cancer. Each of these cancers has a different procedure that physicians need to go through. There are presenting signs and symptoms which might be ignored. And the net result is that the physician in the particular case that we're talking about did not respond to either the signs and symptoms, did not review an imaging study, did not do that which should have been done, and unfortunately in a cancer case, that means that the cancer grew, it spread, sometimes with disastrous results for the patient. Now, there are other kinds of cases besides cancer cases. There's a failure to diagnose an infection too. Similar kind of idea though, the infection isn't diagnosed and so the infection spreads. And unfortunately, people can die from that. There can be bleeding after surgery, and that isn't diagnosed. And as a result, the patient bleeds out, dies, and has some other terrible thing happen. So, whatever the failure to diagnose disease entity may be, the process of the physician not seeing what was there to be seen, not avoiding a harm that could have been avoided, that process is the same. If you have a case that you think involves failure to diagnose and you would like us to look into it for you, please give us a call.